You're watching TVC Breakfast. Now let's get to talk about what is happening globally, particularly in Nigeria, precisely. Tertiary healthcare institutions are considered as hospitals where state-of-the-art infrastructure exists for investigation and treatment of complex medical ailments. These healthcare institutions are where medical research is carried out with medical experts and consultants. While this is the standard across the world, Nigeria's healthcare sector and indeed its tertiary healthcare institutions have not been able to meet up due to poor infrastructure, inadequate funding amongst others. In a bid to address the current state of the Nigerian tertiary health sector, the Senate passed the Tertiary Hospital Development Fund Bill for the rehabilitation, restoration and consolidation of tertiary healthcare in Nigeria. The big question is, how can the government ensure the quality tertiary healthcare is provided for citizens? Have joining me via Zoom consultant, neurosurgeon Douglas Oko. Thank you so much for being on TVC Breakfast.
Thank you, Michael, for having me.
Well, we often talk. Good. We often talk about the primary healthcare system, the secondary, tertiary, and I think there is one quotentiary I really can't remember. But then, how does tertiary healthcare compare to different classes of healthcare system?
Okay, so basically, Michael, you're absolutely right. You have different levels of care. Primary care is for basic healthcare needs. That's where you have your primary healthcare sectors. Secondary healthcare is for something a little bit more complex, a little bit more difficult, and that's where you have your general hospitals. For example, in Abuja, you have like Asokoro, Maitama General Hospital. So those are secondary level care. Then you have the tertiary care, which is supposed to be like the highest level of care. And you have hospitals, like most of the teaching hospitals, the federal medical centers, and these kind of facilities are basically to actually provide more complex healthcare or patients who have complex care needs. Okay. There's also one other level, you are saying it, and that's quaternary. There are two main subspecialties or specific specialties that are actually quaternary care, and they are neurosurgery, which is looking at patients with brain and spine problems, and cardiothoracic surgery, looking at patients who have heart and lung problems.
All right, but then generally, generally Nigerians are not satisfied with the current situation of the health sector. So how does this affect our health, the tertiary healthcare services, and what do we need to do?
Okay, first of all, the question is about quality. Okay, safety and quality, but quality, I'll talk about quality. So when you talk about quality, you think of things like, standards, excellence. You think of things like the degree of excellence, the experience, the outcome of the patient's journey. Those are things that come to your mind. So if you are trying to generally actually try and say, what mark will we give Nigeria in terms of the healthcare system generally, or actually looking at tertiary healthcare, and you look at things like poor quality, good quality, excellent quality, there will be a tendency to actually move towards and say, we probably have poor quality. Major issues that we have. But in terms of how we actually move forward, Michael, we actually try to move things ahead. A few things we need to do. Number one is governance. Okay, governance is extremely important. Governance to actually show the way, to actually show the body language that, hey, we really want to actually truly provide proper healthcare for Nigerians. One of the things I say is that the tripod of any developed economy is actually health, education, and infrastructure. So healthcare is extremely important. So we need governance at all levels, vertically, horizontally, that show them, hey, we are really serious about this. We have fundamental problems because we are a low-income country, low to medium, but actually low-income country. So that means that when you talk about funding and financing from the governance point of view, you have to be very strategic and very innovative. Okay, tertiary healthcare is extremely expensive, and so that means you must think properly, and be actually strategic in terms of funding. Governance in terms of quality assurance. Okay, governance in terms of capacity. And when I'm talking of capacity, a few things come to mind. Human resource for health. We know when we look at things like brain drain, nurses, doctors all going out because they don't like the environment where they are working and the pay is not really great and all that. Okay, so human resource for health and the capacity of that human resource for health is extremely important. Infrastructure within healthcare. Okay, equipment, technology, these things are extremely important. Now, how can you actually, from the governance point of view, looking at all these things that I've talked about, what's one of the ways that you can actually try and bridge the gap? Michael, that is public-private partnership. And I'll give you an example of what I mean. Okay, if you look at the average tertiary hospital in Nigeria, okay, they have like an average of 6 to 8 theaters. Theater will be operations. Okay, if you compare that with a place like UK, for example, the average teaching hospital has like 40 theaters. Okay, so compare the amount of work going on there. So just imagine you have private hospitals here and there that have good theaters. I can tell you that for sure. Okay, and not much work happens there. Imagine a collaboration between a public tertiary hospital and these private hospitals, where you can actually move patients and stuff like that. So I'm just giving that as an example. One of the other key things from a governance point of view that will actually help to actually improve the quality of the kind of tertiary healthcare that we provide in Nigeria is centralization of tertiary care. That's extremely important. One of the major problems we have is that we are duplicating functions too much. For example, I'll give you an example. In Abuja, for example, you have neurosurgical units in 3 of the federal hospitals, in National Hospital, Federal Medical Center, Abuja, and in the Abuja University Teaching Hospital in Gwagwalada. Okay, imagine if you centralize the neurosurgical unit, where what I described as a hub and spoke model, where you actually have patients coming in from the periphery to that hub in the center, and then the turnover of the kind of work that you're doing is really, really high. That really helps with capacity building, helps with efficiency, helps with effectiveness, helps with actually delivering good outcomes, that helps to actually improve the quality.
Right.
So I've said a few things, Michael. I've talked about the strategic and innovative funding.
Well, let me quickly jump in, because we are also looking at how to generate funding. I mean, how the government can actually tap from different avenues to generate funding. But this is Ibrahim you're speaking with. I can see that you're trying to re-Christian me one way or the other. But, so
Ibrahim, forgive me, Ibrahim.
Right. So many countries utilize earmark taxes, as a means of generating funds for health sector and also funding key health projects. For instance, if you look at Ghana, they currently earmarks 2.5% of value-added tax collected to fund its national health insurance scheme. The Philippines also has a public health tax on alcohol and tobacco. Where do you think we can also look towards in this country, where the government can actually, get some money to pump into the healthcare system?
Ibrahim, first of all, I apologize for calling you Michael.
It's okay.
But key thing here is that these kind of special types of taxes for funding of healthcare are extremely important, and we should go for it. For example, you can actually have mobile phone tax or data tax and stuff like that, and the examples that you have. But guess what? I would propose that most of those kind of funding goes to actually primary healthcare, okay? Because that is the bedrock of any healthcare system. Any healthcare system that's really going to function must get its primary healthcare system right. And so that kind of special funding, just added to, for example, like the basic healthcare provision fund that we have already, we need more funding for the primary healthcare sector. Now, the kind of innovative funding that can come into the tertiary healthcare sector is actually what I talked about already, Ibrahim.
Yeah.
The public-private partnership, where you actually have private sector players actually investing in tertiary healthcare. And I'll tell you the reason why I say this, Ibrahim. If you get your primary healthcare right, you prevent a significant number of the population from actually getting to tertiary healthcare. Okay, and it's the bedrock. And let me give you. I like giving examples. Imagine a patient, an individual who has diabetes and hypertension, right? If at your primary care level you can actually monitor and actually manage that diabetes and hypertension, you will prevent that patient from actually getting a stroke. A patient who has a stroke automatically is tertiary healthcare, and you're spending lots more money in terms of resources, in terms of the stress on the patient's family and all that. Okay, so special taxes like that you want to talk about in Ghana and stuff like that, we actually need that. That's absolutely fantastic, but they should be geared towards more of the primary healthcare system.
Right. You're actually, concerned about ensuring that we have, we make sure our primary healthcare system is well established. But then, several studies have shown that if the 20 teaching hospitals spread across the 6 geopolitical zones in the country are refurbished, and made to function optimally, Nigerians will not need to travel abroad to study medicine, or if they do, they won't have to go abroad for medical treatment, and it will prevent brain drain in the health sector. Does this make sense?
Absolutely. Absolutely, absolutely. You are on point, Ibrahim. Okay. The truth is that when you look at the Nigerian healthcare ecosystem, everything needs to be touched with that one. Okay. Everything, all the way from primary level care, secondary level care, and tertiary care. Okay. Investment in buildings and technology and equipment, Ibrahim, is absolutely fantastic. And we need to move with that. But to tell you the truth, is fundamental weakness we have in our system is actually the human capacity. Guess what? That's actually the truth. The human capacity in terms of the human resource for health is extremely weak. Very, very weak. So all I'm trying to say is that from a governance point of view, while we are investing resources and stuff in technology or refurbishing this and that, we truly need to focus on the human beings who actually deliver this care. Okay? Because focusing on the human beings and truly putting resources there to actually build their capacity, to actually train them in such a way where their soft skills in terms of their ability to communicate with patients, able to manage resources properly and stuff like that is extremely important. All the key pillars in terms of delivering care at any level, okay, be it in terms of the financing, the technology, the equipment, so they are all important. But guess what? The most important are the human resource. Okay, and truly, that's what we really need to focus on that.
So we want you to speak to the fact that we really don't want our citizens to go out there to practice or to also study, and we don't want them to go out there for medical tourism. We read recently that there are neurosurgeons who actually helped in separating conjoined twins in Ilorin, I guess, or somewhere in Nigeria. So what would you recommend at the end of the day for the government to ensure that our tertiary healthcare system is, up to date, it's top notch?
Okay, so what I would recommend is everything I've said so far. Okay, making sure that the governance in terms of the funding, in terms of the building the capacity of the human resource, in terms of centralizing tertiary care, in terms of looking at some strategic quality assurance strategies, in terms of some true advocacy, of actually the capacity. Because that's another thing we actually have, especially within the private sector. That's another thing, Ibrahim. The private sector has done an absolutely fantastic job in terms of actually showing the availability of that capacity to actually provide complex care for Nigerians. So the truth is that, for example, I tell people that 85% of Nigerians who actually go outside Nigeria for neurosurgical care, brain and spine surgery care, do not need to go. That capacity rests within. And again, you can see where the public-private partnership comes in, isn't it? Because if you have the private sector actually doing a fantastic job, they need to actually start dovetailing with the public sector. And that key thing that we need to do to actually make sure that we actually have that quality and keep Nigerian healthcare workers on the ground and keep Nigerians within Nigeria not to go out is regulation and monitoring. Regulation is so weak in Nigeria. Another thing we also need to do is that we look at the capacity in terms of the numbers of healthcare providers that we have. One of the things we need to start doing is what we call task sharing. We need to start expanding the scope of other healthcare professionals who are not medical doctors.
Right. So
we need to start having nurses, taking some of the roles of doctors and stuff. And if we do most of these things I'm talking about, I tell you, the quality slowly of the tertiary healthcare that we provide in Nigeria will improve. And we need to continue to do this, because the Nigerian patients are worth it. The other patients anywhere else in the world.
Consultant neurosurgeon Douglas Oko, thank you so much for your insight on TVC Breakfast this morning.
Thank you.